Hi everyone. This is a lecture focusing on two important skills in a group experience, cutting off and drawing out. So we're going to start with cutting off, and this is essentially helping somebody who is dominating the group verbally to get them to redirect and get other members involved. Um, it is an important one. I, I'm not sure I would say it's the most important skill because I think the more that you can facilitate the group in a way that allows the client an awareness that they are dominating verbally in interpersonal interactions and allows the client to make that behavioral change without you having to impose it on the client, that's the more ideal situation. And I'll give you, as we move on here, I'll give you some examples. But you do, you get talkers, you get people with just a lot of energy, you get people who want to be center of attention, just the full range here. And at times we have to, uh, you know, as the author said here, block or intervene. I tend to think of it more as distract and redirect. And so you can use both your voice and nonverbal signals to let everybody in the group know that we're going to be, changing our course of action here. And so you can do that by modulating the tone of your voice. So if I want everyone to calm down, I talk in a really modulated, soft, calm tone. But if I need everybody to get involved or I need to cut somebody off, then I might raise my voice like this as a way to say, we need to shift gears. You can also use nonverbal signals. So I tried to use my eyes and just go in a circle around the group to make sure I'm getting eye contact with everyone, that I see everyone, that I let them know I can see them. I also use my hands all the time, everybody this way. Let's take a moment to pause with my hand up. So you can, without surprise here, as we are the tool, you can use your body to do this. And the earlier you can, block, cut somebody off, redirect, the better. And so some of the ways that you can do this without, really causing conflict, because I know that's sort of the fear in cutting people off is, that they're going to feel hurt or, what they have to say is not important. And so, you can just you can say it's the way in which you say it. So I might say to a group of clients, let's pretend Abby's talking too much because that could happen. So Abby, you're offering us so many clear insights today. I'm really proud of the work that you're doing, but I'm really curious about how other group members are experiencing COVID right now, and I want to check in with everybody. So let me ask a clarifying question. How is everybody using their self-compassion skills in this moment in time when it's really hard to do so? And I'm going to do a round and stop at each person and ask them to, give me a couple words or a metaphor or, just thinking about our rounds and dyads. Again, we want to create intimacy, I think, when there's somebody who's really dominating the conversation. You can ask people for feedback. I love to ask in the moment questions about the group experience. So how does it feel for me to be facilitating with you right now? How does it feel, or I'll just bring up, listen, I'm recognizing that only Abby has been really sharing in the group right now, and I'm wondering what that's about. Can we talk about that a little bit? Let's go around in the circle. So everything you're doing in this way is bringing other people in rather than telling Abby something that might be considered or perceived as critical. And you sometimes, think about this with children. You don't just tell a child to do something one time and they do it. Obviously, we have to tell them multiple times in multiple ways, and group is no different. Don't expect to be able to do it once and you're one and done. Sometimes you have to do it a bunch of times in one session. And if I'm really struggling with somebody dominating, then I ask to speak with them one-on-one. But I really have to tell you that this has very rarely happened. it's much more likely that I have to draw somebody out. So usually what I find happens in terms of, if I have somebody dominating or needing all the attention on them, uh, they are providing the group with a lot of content, but not necessarily a lot of information about, what type of emotional self-awareness are they gaining by sharing this content with us. So, what type of feelings come up for you as you're talking about this story? How about for other folks? And so this is another way to shift it back. So conflict occurs in groups. It's really normal. And I think there's a full spectrum here in terms of what could possibly happen in terms of conflict in the group, right? Different levels. And so um, I really have to sort of come back to reiterate the importance of the group rules, because if you've really established them well and created a safe space of safety and done the pre-screening necessary, you're not going to get to the extreme levels of conflict that I think scare most new clinicians. So, or I could say even, more advanced clinicians. Nobody likes a lot of conflict. I mean, let's be real. So, but if there are times when people are, saying things that are inappropriate, racist, homophobic, prejudicial in some way, um, I need to stop the group at that point and say, that is hurtful and inaccurate or inappropriate. And let's use the space as a learning space, though, right? So, how did other group members, what was the impact of what John said, about LGBT community? How did that impact others in the group? John, as we're telling you what the impact of your statement was, what's going on for you listening? What kind of emotional experiences are you having? Let's just take a pause. Give me just one word, give me just one phrase. These are some other ways that you can pull in some of your round interventions into cutting somebody off. But if something really bad is going on, I mean, it's just, for lack of a better way to say it, it's gone to shit, then you are just going to stop that group and say, you know what? It's time for a cigarette break or a breathing break, and we're just going to stop right here. And John, I'd like to speak to you individually for a second. And sometimes there's just a need to shift the focus because maybe you're doing a psychoed group and you have a lot of information to cover. One of the ways that I deal with this is just to tell people when we're in the part of, let's say I'm lecturing and then, there's a part where people are asking some questions. I just say from the beginning, okay, let's have 3 or 4 questions or comments right now. And then in this way, you can also limit the amount of questions that you're going to respond to, and it doesn't come across hurtful because you've already let the group know you can only do 3 or 4. And typically, if we were land-based, your clients could see your eyes and your body language and identify who you had seen first and that kind of thing. When members are arguing, again, we want to take a pause, but I see every kind of relational disconnection as an opportunity for even deeper connection. And so if you have two people who are arguing with each other, maybe you just say, hey, y'all, I just want to sort of identify right here, John and Abby are having a conflict. What has this happened for anybody else in the group before? Why is that? How have you dealt with conflict? What has conflict meant to you? What's effective conflict resolution look like? So I like to begin first with finding out what the client believes, what all of the clients believe is an effective way to communicate when you don't agree with someone, so that we can get real clear about what assumptions we've all been working off of. This helps to build empathetic connection. And then if it's really severe, I like to coach somebody through it. There's also an intervention that you can do in the group called a fishbowl experience, which is where you have a smaller group. Let's say you have 10 people in the group. 5 people in the group would go to the center of the room and form a circle and have their own group, let's say on conflict. and then the group around them is just observing the process of the group experience while the other members are talking. And then you switch positions and you talk about what each has seen. So again, it's just about, continual self-awareness. And also just to highlight, because I know many of you will be going into community mental health, some people are just not appropriate for group. And so when your boss comes to you and, numbers are low and they want to push somebody in, you really got to be arguing hard and advocating that that is an inappropriate boundary. This person really needs individual before they can go into group. And finally, when we're talking about rescuing, so what happens is somebody shares something very painful, and then people will say, but you're doing a great job. We're so proud of you. And in doing so, this unfortunately then shuts down the speaker, who's just shared that they're really suffering, because then they're going to, have a sense of shame possibly about, sharing their pain. And again, this is worth a conversation. Let's think back to our self-compassion experience. Everybody is suffering. How do other people deal with suffering? How did their families of origin deal with suffering? What was role modeled for them? What might it look like? How has that helped them in their current relationships? So these are some questions that I like to ask, and no matter what, I want to bring it up in the moment. So I'm noticing, Abby, that you seem to be in rescue mode with John right now. Can you tell me, I'm seeing you sort of just want to help him, hold his pain, but in doing so, you might be shutting him down. Do others in the group perceive what I'm perceiving? And of course, I would only ask a follow-up like that if I know that the group has the capacity to provide that kind of information. So we also, and I think more realistically, do a lot of drawing out. And so, thinking back to when I first asked you, why does Yalom, when he was a college counselor, everybody just wanted individual and not group? When people come to group, we know they're anxious, they're more likely to be hesitant until they can trust. And so how can we help people, it says here are shy, but I like to go from the perspective of, just everybody experiences shyness at some point. So how can we get everybody involved? Just to think more holistically about getting everybody, engaged in the group experience. And I think probably maybe three. Three of the most common reasons that people don't speak in group: fear and anxiety. I think also when we're maybe doing something that involves processing, giving people enough time to think and process, that can sometimes make the therapist anxious, because we need to sit there for several minutes while they're working on something, and quote unquote, we feel like we're not doing anything, missing that we're actually, holding space, and our presence is allowing our clients to feel a sense of safety in order to do that thinking and processing. So we have to, sort of work on shutting ourselves up at times. But this is certainly a reason that people might be quiet. And then the next thing I think is really lack of trust. If somebody feels like they can come into the group and say, I'm not prepared, I'm not totally here, I'm not understanding, then like if trust is there, group members will feel safe to say those things. If there is a lack of trust, then we might need to just highlight this also in the moment. So, this is where I might use a little self-disclosure just as a way to address some of the power differential. So, I am a pretty anxious, sensitive introvert, and I also find it really challenging to speak in groups. And so, if there's anything that I can do as your leader to help you feel more comfortable or to draw you out in any kind of way, please let me know. I also think that it's really normal and in no way pathological to feel fearful when you first join a group. And so, really, I would say for the first 1 to even 4 sessions, I'm not pushing on it. I'm giving opportunities to the quiet members to get engaged, but I also allow people to kind of, you know, ease their way in. I'm not, metaphor of jumping into the pool. I'm definitely the person that likes to walk into the pool slowly. And so I like to give everybody that kind of space too. So I just think the easiest way to do this, to draw somebody out, is to ask a question. And so this is really, again, where I'm using rounds and dyads. So I want everybody here to tell me, what has it been like to be home and isolated for so long? How have you been handling it? And, maybe even perhaps for some of you, it's been okay. So I just want you to really reflect on how this experience with COVID has changed you. Let's just take a moment to do that. And then what else? Again, I want to use the dyads for the intimacy. So please turn to your partner to the right of you and just share for a couple minutes and see if there's any themes between what each of you has shared. And then what I'll do is, when I'm going around the group, I'll say, okay, it looks like Abby and John, you were paired up. And then I might specifically call on the more quiet member, and then see if I can get the other member to support. So, Abby, can you tell me a little bit about the themes that came up for you and John? And then, John can support you with anything else that you might have missed. So in this way, you're sort of directing the process and telling them how to get involved, which I also think is critical through a cultural competence lens. You can certainly use your voice and your attitude. If I come in feeling really, with from a place of authenticity, and as we're going to talk about this week with person-centered approach, a sense of congruence. So how I am in this moment is truly how I am. I don't have any masks on for you. I'm not fronting in any way. That can also help other people to get comfortable and draw them out. And then here you go. Here are some techniques the author has used. Again, you can see I use dyads and rounds all the time. Written exercises can be really helpful, although you have to be careful with this one not to become overly reliant on worksheets. But definitely written exercises can be a way, that if somebody's so anxious, you can tell that they might be struggling to verbally process, then just being able to read off what they have can help. Just being, sort of side note here that, um, if you're doing anything with written exercises and you have people, you don't know if you have people in the group who have learning disabilities. So you can also, say that, anybody in the group can read their response, or you can also ask anybody in the group to read your response for you. Another way to get the group to help itself. Your use of eyes. And again, if I have a group from like 6 to 9 doing an intensive outpatient group or something like that, you've got to get people moving. They're tired, they need to move. Get them up and stretching, do activities, that are movement based. And so, again, these are two really important skills, and at the end of the day, it's our energy that really directs the group experience. So if you come in kind of energized and wanting people to engage in that way, they probably will. If you need people to kind of chill and get into a meditative space, they probably will. But it all begins with you, which is why it's so important to have your own self-compassion, mindfulness practice. In addition, I would really encourage everyone to have a communication partner. I think it's critical in a counseling program to be practicing these active listening skills that appear so simple but can be so complex, when applied in a group setting. And so just practice is important.